Next presentation is by Dr. Natasha Radhakrishnan. Is there a ROP epidemic? Results from a decade of ROP experience at a tertiary care center in Kerala.
Change on Natasha. Can you make it here also full? Good morning to all. My topic is there a ROP epidemic? Results from a decade of ROP experience at a tertiary eye care center in Kerala. So ROP, as you know, is a vasoproliferative disease that affects premature infants and is on a rise in India as a result of the improved neonatal care and better neonatal survival rate. Approximately 2 million babies out of 26 million annual live births in India are born with birth weight less than 2,000 grams and are at risk of developing ROP. What has happened in India in the last decade? This study was designed to understand whether the incidence of ROP has increased over the last decade in spite of great advances in screening, detection, and treatment. So aim of the study was to compare the incidence of ROP any stage and treatment requiring ROP between 2009 to 2013 and 2019 to 2023, 10 years apart, to compare the demographics of premature births screened for ROP, including gestational age and birth weight in this study period. Materials and methods, we conducted a retrospective comparative study of the data from a tertiary care center during the period specified earlier. In our center, babies less than 35 weeks and less than 2,000 grams are routinely screened for ROP. The examination is done by a trained retina surgeon after dilatation with a mixture of diluted phenylephrine and tropicamide, and treatment requiring ROP was defined as per the ET-ROP criteria. Fundus examined with a binocular indirect ophthalmoscope and 28D condensing lens. Data was entered into the ROP sheet as per ICROP guidelines and scanned into the EMR. The data from these 5 years, 10 years apart, was obtained from the EMR and entered into a proforma for the study. Gestational age, birth weight, risk factors of ROP like hours of oxygen use, ventilation, blood transfusion, anemia, stage of ROP, presence of ROP, treatment details, and regression were also noted. Statistical analysis was done using the SPSS statistics software, and the results are given in mean plus standard deviation for continuous variables and frequency for categorical variables. Pearson chi-square test was used for finding the association between categorical variables, and to test statistically significant difference, independent sample test was applied. We looked at screening and treatment data 2009 to 2013, 2019 to 2023. A decade back, 343 babies were screened, and from 2019 to 2013, 771 babies were screened. Number of subjects screened by time period is shown in this graph. If you look at regressed ROP and treatment requiring ROP between these decades, a decade back, 343 babies screened, of which 58 babies developed ROP, 20 babies, 5.8% developed treatment requiring ROP. After 10 years later, we screened 771 babies, of which 128 babies, 16.6% developed ROP and 6.5% required treatment. There was no statistical significant difference in these two groups. So this shows the distribution. You can see they're almost neck to neck between the two decades. Distribution of gender by time period in subjects who developed ROP, there is some difference between the two with a male and female difference, but it was not significant again. Comparison of birth weight and gestational age. In mean birth weight was found to be 1.08 a decade back. Mean birth weight is 1.5 now. Although the average birth weight is lesser in the current decade, again, it was not statistically significant. A comparison of gestational age, the mean gestational age was 29.36 earlier, and it is 30.36 now. Again, not statistically significant. Now, when did ROP develop over the decades? Again, in the 28 to 35 age group, that is the week when ROP developed, decade back, and it is the same time that ROP developed now also. Distribution of birth weight also, the category that maximum ROP developed was in the 1.5 to 2 kilogram birth weight. So in inference, the number of preterm births are very high, and therefore ROP screenings are more than double of the last decade. The overall incidence of any stage of ROP and treatment requiring ROP remained almost the same. The gestational age group at which maximum incidence of ROP occurred also didn't vary between the 2 decades. There was no statistical significant difference between the 2 sets of data 10 years apart, except in the number of babies that were screened. That is, the number of premature births that have increased. So the main purpose of the study was to compare this, and the percentage of spontaneously regressed ROP and treatment requiring ROP was also compared. And with the number of neonatal NICU increasing, about 700 government special newborn care units are there across India. So India is currently facing an ROP epidemic, and however, there is difference in range, place to place. Inconsistencies of neonatal care have led to large variability in ROP incidence and severity within India, and oxygen delivery and monitoring also varies. A study by Bowie et al. Compared the incidence in a number of countries, and they found that the number of infants screened has progressively increased from 2010 to 2018, and the prevalence of ROP was 38.45%, any stage. Another study in North India got 18.8% of ROP. But in our study, we found that the incidence of ROP was much less in Kerala. This is in our study in both 2009 to 2013 and 2019 to 23, we had only around 5.4% and 6.5%. So even inside India, the challenges due to increasing numbers of premature babies are different from different states. And the increase in number of premature babies that require screening was more than double, which shows that more training of ophthalmologists is required to take up the screening burden. But the treatment requiring has not increased is to some extent reassuring. The reason could be better awareness of the risk factors for ROP among neonatologists, controlled and judicious use of oxygen, and good supportive neonatal care. Our limitation is that although we have kept the screening criteria same, some treatment guidelines and treatment protocols have changed over the last decade, and this is the confounding factor. So in conclusion, there is a definite and significant increase in number of births, but almost similar incidence of ROP, especially the treatment requiring stage. Even then, the increasing numbers means that we should train more and more ophthalmologists to screen for ROP. Thank you. These are my references.
Do you have any data on how many were IVF babies or had assisted fertility issues, or age of the mother? Because
no, ma'am, we have not
number
taken.
of premature babies doubling, you have not looked into any of those factors here.
We routinely screen babies who are coming in from an IVF center also. So both sets of data have those babies, but exact number I have not looked into.
That could be one reason, and of course, very huge payouts by cohorts.
Yes, ma'am.
Very nice study, Natasha. So you have already give a recommendation that we need to increase that number of ophthalmologists who are qualified. Any other recommendation you want to highlight?
Increasing the awareness among neonatologists, because even now there are several pockets where the screening is not happening. So that also is very important.
And public awareness.
Public awareness also, yes.